Hi, everyone. This is Deborah Hamilton, and today we're going to talk to Dr. Julie Liu. She has started a new business called My Family Cat in Austin, Texas, where she comes and helps evaluate your cats at home so that she can partner with your veterinarian to give the best care to your pets that can be done. She also is a fear-free certified veterinarian and a veterinarian. She gave us so much great insight and information on how to find a great vet for your cat and also how to really understand what your cat is saying or doing. So let's listen to what Julie has to say. Hi, I'm Deborah Hamilton. Welcome to my podcast, Why Do Pets Matter? 10 years ago, with my iPhone and a script, I recorded the first episode of the Ultimate Pet Resolution Summit, which chatted with experts about conflicts over animals. Our conversations were intimate, honest, and illustrated how disagreements over animals occur and how those disagreements can reshape people's lives and relationships. In November 2019, I started Why Do Pets Matter, a new podcast that continued these informative discussions. I'm so excited to have you here with me, continuing my exploration into a more meaningful conversation about why pets matter to all of us. My guests and I will share ideas, stories, and experiences straight from the heart, unscripted and holistic. From the bravest moments to the most brokenhearted, we will explore how to resolve disagreements over animals differently. One thing I know for sure is I want to have more meaningful conversations that will help all of us unlock that deeply felt human-animal bond that drives the emotions of conflict. Hi, everyone, and welcome again to Why Do Pets Matter? Today, we're here with my good friend, Dr. Julie Liu. She is a solopreneur. She has so many things going that are so supportive of pet parents. She has My Family Cat in Austin, Texas, which is really something you need to check out if you live in Austin. She's also a consultant and a speaker under the term Flex Care, where she talks to pet parents. And I love that Julie wants to always have good communication with pet parents. So Julie, welcome to Why Do Pets Matter?
Thank you so much. Thanks for having me.
Oh, I couldn't wait. We have tried to do this a few times and I kept getting sick. So thankfully I'm well now. I haven't broken any bones. I haven't had anything replaced and I don't have COVID. So we're good to go today. So Julie, what we do, how we start is that I ask you the one question, which is why do pets matter to you?
Wow, that's a pretty big question. I would say, professionally, pets matter because, they're part of everyone's family. And, I think when we think about treating pets as, vet professionals, we are really treating people's family members. And, there's obviously the medical side, all of that, but all of these kind of emotions are wrapped into, the patient that, I see before me when I go to the clinic or when I go do these house calls. And then in my personal life, I've had pets for pretty much my whole life. I actually never had a cat growing up, but I wasn't until I actually had my first cat, and maybe you can relate to this since your son's cat, comes to stay with you, your grandkitty, as you said. But I don't think I really appreciated cats till I had my first one. And then you start to see, oh my gosh, they do all these cute things. And this is like cat behavior and just, all the different things that are really unique to cats. And so once I had my first cat, I really started to become feline focused, both professionally as well as my pets. So I have had a couple dogs in Austin, but I'm truly like a cat person. And I think of my pets as my family members. Like I don't have kids, but I feel like I currently only have one 17-year-old cat. But he's definitely my family. And as I always like joke, he's almost ready to graduate high school. So he's
Ready to
he's
get
going to
in
be going to
trouble.
college next year.
Yeah, he's going to college next year. He's going to get the
Yeah.
car. You're in big trouble now.
Yeah, exactly. Yeah.
And because he's a cat, he can drive the car.
Yeah.
I'm telling you.
Are you talking about like Toonsis from SNL?
Yes.
Yeah.
Yes, indeed. Yes,
Yeah.
indeed. So it's so interesting that you focus on cats because most of the time when we talk about people in Why Do Pets Matter, I always love to get professionals who are focused on cats because sometimes they are the forgotten pet because they don't go to see the vet very often. A lot of people feel that because a cat's an indoor cat, they really don't have to see the vet. And you and I both know that that is so not true. I didn't realize until I was a moderator for a program at VMX, the Veterinarian Conference in Florida, where a veterinarian came in and said, this is what you bring in on your shoes to your house cat. And so really you need to think about making sure your house cat is protected. So I'm sure you have a lot of information to share with our cat listeners and our dog listeners too, because we sometimes think if a dog is on a wee-wee pad in the house or a cat is a house cat, that they're not going to pick up anything. And unfortunately, unless we stay inside and don't come out at all either, which is pretty rare, although there is DoorDash, that they are susceptible to what we're bringing in.
Yeah, there's definitely, those issues. So I definitely have my, work shoes that I leave outside my door before coming in. And if I'm wearing scrubs, which I do when I go to work, I will change my scrubs before interacting with my pets. But yeah, I mean, all pets need care. And I think cats especially because they have traditionally like a really high fear of the vet. They don't want to, they're scared of the carrier, they're scared of being in the car, they're scared of being handled at the vet. Like all of those are these barriers to them getting the care they need. And so I think it's just really trying to address that in all these different ways, talking to vet professionals on different ways we can handle cats to help facilitate care. Yeah, I think all of that is really important. And I think especially when it comes to cats, I don't know. I feel like, and this is just my own impression, but I feel like the vet world is kind of made of dog people, kind of like how the pet world sometimes seems to be made of dog people. And so, really, I do I offer general practice relief as well, so filling at different clinics, and just it's been my observation that a lot of people really maybe prefer to work with dogs. They find dogs easier and all of that. And so yeah, so I think that education's really important because all cats need care. I don't care how old your cat is. They could be 6 months old or 17 like my cat Puff. Like they all need medical care. And so trying to really find ways to make that as stress-free as possible is really important.
It's interesting because dogs don't necessarily like the vet either. I mean, they come in and they're shaking and everything, but you know
Hmm.
they it just seems like people will overcome it because it's sort of recognized care to bring your dog in, and yet cats don't seem to hold that same spot in need for care. And I know there are certain things, hairballs, teeth, uh different things, and their nails, different things that really need to be cared for. And if you're not good at doing it as a pet parent, then being able to find a trusted partner who either has a practice that is sensitive to cats, like maybe having a cat day, or finding a practitioner like yourself who will, alleviate the need to get them in the cat carrier and take them to the vet, but will, really work with them at home. So tell me a little bit more about that, because there are certain things that cat owners should be aware of that they need to have their cats tested for, especially if they don't take their shoes off or they don't take their clothes off. And the first thing they do is, or wash their hands, the first thing they do is interact with their pets. And this is, please, this isn't a blame game here, or this isn't shit. I don't do that. I pet my dogs and I walk around with my shoes, but I take them to the vet. But if you have a cat, it's something that you really need to make sure you take precautions for. So what are some of the things that would benefit the cat's longevity? And also, I will share that Jane has no teeth. I mean, I think she has two canines, maybe three, because she had something as a kitten, because she's a American short hair, and her teeth went bad. And it's funny because I was at a vet conference with Diane Inger, Dr. Diane Inger, who's like another really good cat person who's been on. And she said, well, she probably didn't need all her teeth pulled out. And I said, well, that's what the vet said. And I'm sure you've seen that happen because there's not a lot of long-term education in why it might be good to find a vet who's sensitive to cats' needs.
Yeah, I think finding a vet professional who you trust is so important because it's not just a vet saying, well, here's my recommendations, goodbye. It's like, okay, these are my recommendations. What do you think? What are your concerns today? How do we address your concerns, but also work together to make sure these medical needs are met? And so, yeah, there are a lot of things that pet parents can do. And I think, you know, a very basic one that doesn't seem like that big of a deal, but I do see get missed is just regular exams, regular vet visits, because there's so much that you can find. So back to your the jade that you're mentioning, we routinely find things like, dental disease, fractured teeth, cats that are overweight, cats that have skin issues, cats that are chronically vomiting, all of those things. And, I think if your cat's scared of the vet, that, you maybe are hesitate before bringing them to the vet. But also if you haven't really found, a veterinarian or a vet clinic who you have that level of trust with, then that's another barrier that gets added on. So, yeah, I think I really, I like it when I see a client in the clinic who has concerns about their cat and they raise their concerns and then we talk about them together. Because I think there is a lot of worry. So I'm a total helicopter pet parent, cat parent, like I worry about my own cat. Like he's, like I say, he's 17. So he's definitely up there. And so I think that level of worry is really common. But I think some of that worry kind of goes on behind the scenes and doesn't always get raised as a topic, within the vet clinic or the vet appointment itself. And so the more trust that you can build and the more, because you basically want to see your vet as a trusted collaborator. You're working together on behalf of your cat. And yeah, so I think that's really important, really paying attention to your cat's needs and changes. And I know, just thinking about my own evolution as a cat parent, the level of care that my cats got, 10 or 15 years ago is nothing compared to what I feel like the standard of care that I want them to have now. And so your own evolution as a cat parent too, I think is really important and just, yeah, just advocating for your cat's health.
It is so important because in the dog world there are requirements, mostly rabies, for dogs to have, and that's a local law. So everybody has to get a rabies shot, or else they're going to get into trouble. Where with cats, that's not a thing. It might need or should be a thing, and I don't know if that is a thing for cats. That they
It
should get
is.
rabies. I
It
mean,
is. And actually, I see a lot of cats that are not up to date on their rabies vaccines either. Yep.
I know that Jane probably isn't, and
Yeah.
I will be getting off this phone and seeing when she went to the vet, and she loves going in the carrier, not, and her spa visit will not necessarily end well if I decide to take her to the vet. But it does concern me because I don't. A lot of the people who listen to Why Do Pets Matter, a lot of the veterinarians who listen to Why Do Pets Matter, um, they don't understand that cat owners might not know what they need to know, and that's where their
Mhm.
trusted professional comes in. And if you are a veterinarian who is a cat person, it isn't, for all those cat owners out there, it isn't that they're trying to have you buy something unnecessary, but it just seems that cats aren't on the protocol list for preventative medicine.
Yeah, I think there was actually a survey a while back. I think it's probably almost 10 years old, where they surveyed pet parents, so both dog owners and cat owners, and there was quite a few, I think a large percentage of cat owners who, they would get stressed just thinking about bringing their cat to the vet, but they also wouldn't bring their cat to the vet unless they were sick. And that's also my own observation is, well, just not really necessarily knowing the importance of that preventative care, but also that fear and anxiety that you feel as a cat parent, trying to get your cat in the carrier and do all those things. And unfortunately, when we see cats in practice that are sick, I do find that a lot of times it's a little bit it's like longer after the start of the symptoms versus if we see a dog, and it's like, wow, if a person didn't eat for 3 days, that would be concerning, even one day, a person not wanting to eat, especially if it's an elderly person not eating for a day. And so, but I think it's just, yeah, a lot of these things that we're talking about, it's, yeah, it's fear and anxiety and the pet parent as well. But also, yeah, just kind of that general education that all cats need regular care. And, for a cat who's Puff's age, like I even bring them in like every 3 months roughly for things like, well, I have a vet friend who, I bring him to a clinic, but, she does an exam, but she also collects lab samples on him. And that way I can kind of screen him for some of these, conditions that if we find them early, then it's, we can actually, have some sort of impact with medications, et cetera.
To hold off or to maybe solve the issues when they're, like my book, Nipped in the Bud, nip them in the bud before they become chronic, because I know that a lot of cat owners are left with chronic conditions because they don't get regular checkups. Especially, I know kidneys, right? Those are a big bugaboo in cats.
Yeah, the chronic kidney disease, very, very common. But I will say that many cats can live in, with chronic kidney disease for years. So it tends to progress typically more slowly in cats than in dogs. And it's kind of interesting having these conversations because to me, there's so many reasons to do that screening lab work. And I think, yeah, if you find stuff early, you have a much better chance of, having some sort of intervention that will help slow progression of disease. And so, but not just that, just thinking about their quality of life. We might actually be able to find something that will help your cat's quality of life. And that's, everyone's goal, of course. I do also find that some pet parents don't want to know because I've heard this response is, well, I just, I'd rather not know, or, I think they find it too stressful. But I think, some of these things, just even a diet change, can, for example, if your cat has chronic kidney disease, depending on the stage, typically like a prescription kidney diet, can be helpful as far as slowing progression.
It can be a simple fix. And as a longtime dog owner, it just seems much simpler. Even when the dogs aren't happy at the vet, we seem to bring them in all the time. So tell me a little bit more about My Family Cat, because clearly you're helping cat parents meet the needs of their pets with the least amount of agita. Now everybody moved to Austin, Texas, so that you can feed
Or the
that.
Austin, Texas area.
That's right, or
Yeah.
the Austin, Texas area.
Yeah.
Because, and I'm sure that, there are, I don't know if there's telemedicine that is helpful as well, but cats really do need as much care as dogs need. It just isn't traditionally what we do. So in My Family Cat, what do you bring to the pet owners who are your clients that gives them probably incredible peace of mind?
So my family cat is has a very specific niche. So I provide cat behavior house calls. So that means I actually don't go in, I don't provide medical services like vaccinating the cat, clipping nails, drawing blood. What I do is really focus on the behavior concern, because that's something else that really is not getting the the time it really deserves. Because when you go to a vet clinic, some of these behavior concerns, like a cat's, peeing outside the litter box for like 5 years, are you going to be able to address that, in half an hour? Probably not. And so, there's a lot of these long-standing concerns that could ultimately lead to the cat being rehomed or euthanized, or relinquished to the shelter. And so I really wanted to be able to delve more into that. But I also knew that, most cats don't like going to the vet. My cat doesn't like going to the vet. So I wanted to be able to provide this house call aspect to be able to actually go to the cat where they're most comfortable and then fully assess the environment. I do try to perform an exam on all of my patients, and then prior to that visit, I request the records and do an extensive records review. Which a lot of times there's a lot of medical stuff going on with these cats. And then, yeah, just really trying to provide them with that in-depth consult that focuses on behavior. And then if there are medical, needs like a diagnostics or testing or whatever that I recommend, then I will refer them back to their primary vet, and then they will also get a copy of the behavior plan. So I think really I'm kind of back to that sense of collaboration. I try to collaborate with the cat parent, but also with their primary vet, so we can all work together to kind of help, improve that cat's quality of life, and the cat parents too, for that matter.
I love that collaboration, because then that will bring the veterinarian who may or may not necessarily have the understanding of cat behavior that you have um, into, this could be a quid pro quo, right? They have a cat that comes into the clinic that has a behavioral issue. They don't know what to do. They don't have the time to address it. And then they can recommend you because that will provide you with the time and them with the time to uh, ex examine the pet more fully, the cat more fully, right? So they're doing the physical examination. They see something incredible. And then they say, Dr. Lou could come to the house and really watch Fluffy uh, during and give me a better idea. And so your collaboration with veterinarians seems to me to give them sort of an inside look at what's Fluffy like. You can only do diagnostic testing and see the cat for 15 minutes to a half hour. Not a lot going to be necessarily gained in that. But a huge amount would be gained if you worked as a partner with the veterinarian. So that's what you do, which to me is insurmountable for well care for cats. I mean, it's wonderful.
Yeah, and I think, with a lot of these behavior issues, you do want to rule out a medical cause first. Like if your cat is peeing outside the litter box, it's not because of spite or they're mad or whatever. They could have a bladder stone. They
That
could
is where
have,
I would first
urinary
go.
tract infection. What's that?
And that's where I would first go. I must have done something to piss Jane off. So,
Well, but the stress can play a component, with things like
yep.
that. But yeah, and I think, for me, it's just been really great seeing cats, like seeing their real personalities because, most of the cats I see within a clinic, like they're going to be really stressed in various ways. So they're hiding or they're, urinating on themselves because they're so scared, or if they're, showing fear-based aggression. So all these things are just it makes me sad as a veterinarian to see a cat with that level of stress at the clinic. And so when I get to go to these people's homes and just really see how the cat lives and see their real personality come out, like eating treats, coming out for petting, like these are all things that it's not very common to see at the vet clinic.
Yeah. And so it gives you this interaction. It also builds trust and confidence of the pet owner with the veterinarian team because, one vet might be doing all the diagnostic, but not necessarily have the ability you have to do the observation that when taken with the diagnostics will give the pet owner the broader picture of what's going on with their pet, hopefully. I mean, that's the bottom line.
Yeah, and I think it's interesting, but the clients who I've had, they really they want to learn more about what's going on with their cat, and whether that's medical, possibilities that are contributing to this unwanted behavior, whether it's some adjustment they can make in the environment, like scooping the litter boxes, more often, all those things, like they want to learn more. And so yeah, it's been really a really great great experience.
I work with several professionals to do what's best for the dogs. And now I feel as if I need to find a professional to at least have someone nearby here to have Jane on their radar. I would have to make sure that they were cat friendly because I agree with you. I think the cats need to be in a pet friendly environment. I love practices that have cat day or cat
Mhm.
morning so that they're not in with everybody else. It doesn't mean that they can't come in with somebody else, but if you set aside some time, because it is stressful, it's not something that is intuitive to cats to be friendly to everyone they know. Uh, they're a little more aloof, don't you think?
I think it's funny that you use the word aloof because it is something that a lot of people perceive cats to be. I do think, you can't take dog body language and necessarily extrapolate to cats. And
Right.
so, whereas you might perceive a cat as being aloof, like not in the same kind of I don't know. I feel like dogs are, I don't know. Every dog's different, of course, but dog body language is not the same necessarily as cat body language. But no, I actually don't find cats aloof. I do think, just thinking about my own cats who I've had, but also just going to clients' houses, like, some cats, may prefer to be next to you, not necessarily in your lap. So to me, it's like, well, they're still choosing your company just because they don't want to be a lap cat. Does that mean they're aloof? So I think there is a common stereotype, quote unquote, of cats is not really of being like low maintenance and not really needing, as much attention and stuff. But I think, yeah, I think a lot of cats really do enjoy human interaction. But I think just it's maybe a little different from how it might be, with dogs.
So I think you shared with us that you're a speaker. Do you speak to other veterinarians on how to become a little more intuitive when it comes to being a veterinarian of a cat and their cat owner?
Yeah, I am on the Fear Free Speakers Bureau. And so actually one of my favorite talks that I give is about cats because I think this is one area where I think, kind of back to that aloof, topic is I think some people feel like cats are mysterious, they're unpredictable. I know a lot of people have been injured by cats in the vet clinic. And, just kind of a lot of it comes down to, okay, do you have an understanding of their body language? And I know I've been injured. So before, like I said, I never grew up with cats. So I didn't actually have my first cat till I was doing my, kind of working prior to vet school. And I just remember this really severe injury I had where I was just in total shock. And looking back, I'm like, wow, this cat was giving me all sorts of body language signals, and I wasn't even really looking at the cat. And so I think just really understanding the fundamentals of body language is like that's what's going to keep you safe. It's going to help you adjust your own body language so you don't have to, go to these techniques like scruffing that I'm not a fan of. And so, yeah, I
Yeah,
think I
those heavy
really,
gloves that you grab them with and the whole,
yeah,
yeah.
yeah, I think
Imagine
it's
what that feels like to them or what that looks like to them.
exactly. So I think, starting off with learning the body language of your feline patients, but also just even below that is like, wow, what would this feel like if I were a cat? How would I perceive my experience within this exam room to be, manhandled with these huge, heavy, like welder's gloves, be scruffed, like all these scary things that happen with them. And then they get called fractious or spicy because they're behaving in a way that just showing their fear. And so, yeah, and I think, back to my own evolution, like there are things. I'm a 2009 vet school grad, and we would scruff cats like left and right, like all of these ways that I would handle cats that I would never do now. So I think, hopefully whatever field you're in, you should never get to the point, in my opinion, where you just stop learning and stop seeking new information. Because what I did 15 years ago is not what I would do now. And I kind of wonder what am I going to be like as a practitioner in 15 years? But there's always new information coming out, and we really realize, we do need to protect the emotional welfare of our patients. And that starts off with just bringing this basic empathy and understanding about what they're experiencing, to every single interaction.
I love that. I mean, 15 years ago, I was a litigator. Now I wouldn't go into a courtroom to litigate conflict between people over animals on a dare because it doesn't keep the animal top of mind. So
Yeah.
I hear you. In 15 years, you're like, what? You don't what? And I love that you are hopefully sharing with everyone who's listening to this that the animals have really been examined and researched now to a point where we do understand more about body language, about the way they react to certain things, and what we used to think was just grab them and do it, and it's less traumatic because it's over quickly.
Yeah.
Uh, and we're learning that isn't necessarily the best choice. It might be the only choice if that's all you can do and you're in a, confined situation and, a bunch of feral cats say, which, I represent a number of feral cat groups and I have learned so much about feral cats that now I'm sort of the greatest supporter of feral cats because they didn't choose to be there. And yet they really are a good partner in keeping vermin down in the neighborhood if you allow them. But we need the TNR to make sure that they naturally um, pass and not reproduce. But the fact that people are now thinking, I mean, they've thought more about the human animal bond, the human animal interaction. There are now master's degrees out of a number of universities on the human animal bond and human animal interaction, which obviously is something that has definitely impacted on your practice. Julie, tell us a little bit more because it also probably came from interacting with Fear Free. I know that Marty Becker has been on this podcast and he's going to come back again. But he started Fear Free, and it really has made a huge difference in veterinary practices who've taken the time to really be certified. So tell everyone a little bit, because I always like to remind them what Fear Free means.
So fear free means that you care for the emotional welfare of the pet. And this is not just something it's like, oh, it'd be nice if, we could do that. But if you can't, too bad. This is something where you really need to consider that as part of their health. Just like, you probably wouldn't want to bring your cat to a veterinarian who didn't care about your cat's physical health. You should kind of place that similar importance on finding a vet who cares for that emotional aspect. But it's really, yeah, I think it was founded in 2017. And I think I got certified probably pretty soon after that. And, with Fear Free and also what's now called the Feline Veterinary Medical Association, previously the AFP, they've really done so much in just bringing that the emotional welfare of pets to the forefront. And yeah, I think with Fear Free in particular, they kind of think about it as this ecosystem where it's not just in the vet clinic, it's also what is the pet experiencing at home, at the groomer, with their trainer, with pet sitting, all of these things where you can really take them throughout their whole lives and try to support their emotional health through every aspect. So that's something I'm actually excited about seeing, because I think it's great to really think about it in the vet clinic, but that's just a little sliver out of their whole life. When I prescribe medications to a patient, it's not like they disappear. The owner is sitting there at home struggling with trying to give their cat this horrible tasting medication, unless they've actually thought about, okay, what's a way that I could help that cat parent and that cat get medicated in a positive and consistent way. So I think it's really thinking about all aspects of a pet's life and not just what happens at the vet clinic, that I really hope that we start, moving towards that more in the future.
Well, you absolutely have, because you started the My Family Cat that enables people to get more behavioral information about their cats to make their lives with their cats easier. And then working alongside their veterinarians, or maybe you are their veterinarian as well, because that's okay too. But you'd really want to make sure that the partnerships of everyone who is looking out for the best interest of the cat collaborate. Nobody feels as if somebody's stepping on somebody else's toes. The end line, this is my whole thing. I hate when people compete with each other. I'd rather that they all collaborate with each other, which you
Yeah.
and I talked about at length, because it's all about making sure that the family cat gets the best care they can get from their parents as best as they can, from their veterinarians, and then from you as someone who's going to help them see what their cat might need if they're having an issue, as well as being their veterinarian. So you bring so much value in the Austin area to cat owners. I'm hoping that everyone can find you. Let me ask you, Julie, how would someone work with you if they wanted to work with you?
Well, first of all, thanks for your kind words. I appreciate it. So with My Family Cat, I serve the cats in the Austin area. And so my website is myfamilycat.com. I also have an Instagram. So if you're on social media, it's at My Family Cat Vet. And then if you are a vet or pet professional, I do have fluxvet.com. So it's actually FLUX vet.com. And so that's you can contact me for speaking engagements, consulting, et
Because
cetera.
you would be great to provide a video in the waiting room for people who have cats, to help them understand what they need to do and say to advocate for their cats.
Yeah, it's actually something I haven't ever thought of, but I do encourage clients to think about that. So I think, it's great to have, everyone should have a level of respect for their veterinarian and the vet staff, but not to the point where you don't have your own needs as a cat parent met, where you don't want to speak up because you feel uncomfortable or you just like don't feel like it's that big of a deal. That's how we end up with these cats who have been peeing outside the litter box for 10 years before something, gets addressed. So, yeah, one thing I see some clients do is they'll actually write a list of their concerns and just so nothing gets missed. And so I think something like that can be really effective because sometimes you get into the exam room and you probably are feeling anxiety yourself as a pet parent, or you feel the constrictions of the time of the appointment. I may not have time to get everything addressed. And so just organizing your thoughts and just not being afraid to speak up on behalf of your cat, because regardless of how well you know the veterinarian, like you live with your cat 24/7, and so you know your cat best.
Oh, I have to tell you that that's part of what I do at the MAP plan is have people address the needs of their pets. So before you go to the vet, maybe you'll see a video if Dr. Liu decides to make one and give it to you or provide it to veterinarians so that they help their cat owners who are bringing their cats make that list before they come, because that would give the veterinarians a better idea, because it's not like I forgot stuff shit. But always pre-paving, me, Julie, I'm always pre-paving a positive interaction between everyone, trying to eliminate or at least diffuse conflicts, because it's so important to have that great relationship between your pet and your pet care provider, and the pet owner. I mean, that's the triangle that has to absolutely work really well.
Yeah, definitely. And I think, regardless of how experienced you are as a veterinarian, you can't do everything. You can't be everything. So that's why you also need to, find a professional network in your area of
List
groomers,
partners to help
trainers.
you.
Yeah, exactly. Pet sitters, house call vets. There's all sorts of, colleagues in your area who are just have a different scope of practice than you do. It doesn't make them better or worse than you. They just have different things that they do well. And so I think I don't know. I know vet med is getting more specialized, kind of similar to pet medicine. And personally, I'm kind of happy with that because I brought my own pets to specialists. And so thinking just about even, general practice, who are the people in your network that who you can refer your clients to so they can also get that level of care for their pet that you just maybe don't have time for, or, it's like, I don't think most veterinarians do dog training, for example.
Right.
So yeah.
Or feel they're able to diagnose something without seeing the cat in their home, and that's why they would work with someone like you, to be able to make sure that they have that extra additional information so that they can make a better diagnosis, right? Because if they work with you, you go in, you give them the information they need that they can't get themselves in a 15-minute or 20-minute or 30-minute meeting in a hospital setting where the cat isn't necessarily acting the same. Julie, this has been so educational. I am so grateful for you giving us your time, sharing with us the collaborative nature with which you work as a veterinarian, and especially the collaborative nature with which you work with cat owners and veterinarians to make the cats' lives better. Jane, thanks you.
Thank you. Thanks so much for having me, and say hi to Jane for me.
I will, and I will have you back because I'm sure there's going to be something nifty in the next year that you're doing that we need to keep up with. Please come back. Remember, you can get in touch with Dr. Liu by looking up myfamilycat.com, and also Flux, FLUX.com, correct?
Fluxvet.com, FLUXvet.com.
Yes.
Yep.
Thank you. Well, until next time, kiss your pets for me, everyone, especially the cats. Bye, Julie.
Bye.
The Why Do Pets Matter podcast drops every Thursday and can be found on whichever platform you find your podcast. Subscribe now, invite your friends, and I cannot wait to have you join me in these conversations.